Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? A recent report by KFF Health News breaks down what we can expect to see in uninsured rates as a result of the One Big Beautiful Bill. The overall projection is that 10 million individuals will become uninsured across this nation, as we now know from the Congressional Budget Office and have studied. But let's look at a few more states closely. Since this podcast comes to you from Hillsdale, Michigan, we'll start there. The number of uninsured individuals in Michigan is expected to increase 300,000 by 2034 due to the bill, and another 90,000 due to the enhanced premium tax credit expiration. These projections have an uncertainty in their range that could place this rate even much higher. California is expected to see 1.6 million uninsured by 2034, but Kentucky, Louisiana, and Oregon have the highest percentage points for uninsured projections. 10 states have not adopted expansion status, and the bill sunsets the incentive that increases federal matching rates for states, which will result in many uninsured individuals that would have potentially been receiving health care coverage under the new expansion program. On to the damage report. The CDC's Deputy Secretary, Jim O'Neill, was selected by the Trump administration to serve as the acting director in place of the previous holder of the title, Susan Morenez, who was fired after just a month of holding the position for resisting the agenda put forth by HHS. O'Neill has asserted a few goals for the direction of the CDC, including chronic disease research and affordable health care for businesses. However, the backlash of the departure seems to be drowning out any forward action the CDC is making. Monterez's lawyer has made the claim that she was fired without notice for rejecting the, quote, unscientific, reckless directives, unquote, issued by HHS. Now, many are concerned that the lack of clear leadership in the CDC will result in our nation not being prepared for an upcoming flu season. No matter who ends up in charge, the ongoing back and forth struggle for power in the country's leading healthcare organization undermines the vital importance of the role they play in emergency preparation and healthcare advisory guidance for our nation. With every breaking headline, we seem to be moving farther and farther away from prioritizing the health of our communities and the actions we take. In other news, healthcare job cuts are still spiking across this nation. Alphabet's life science company Verily shut down its medical device program and cut an undisclosed number of positions. Intuitive Surgical, another major med device company, has announced that 331 employees will be laid off this fall. CentraCare, a healthcare system in Minnesota, is laying off 535 employees at 44 different locations. Several healthcare insurance providers have cut a slew of jobs this summer as well, including Independent Health, Molina Healthcare, and several state chapters of Blue Cross Blue Shield. Lastly, for our damage report, costs in the healthcare industry are on the rise. Pharmaceutical costs continue to increase, as well as the cost of labor and supplies. The Affordable Care Act individual coverage will experience a 20% price hike in premiums next year, and that increase will rise to 75% if Congress doesn't renew enhanced tax credits at the end of the year. Finally, our success story. Prosthetics have been around since ancient Egypt, but in the last few decades, the field of prosthetics has been advancing to increase mobility and autonomy for amputees. This year, a new bionic knee is making headlines for its breakthrough technology. According to research studies on lower limb prosthetics, this knee allows that greater ability, comfort, and what is called the embodiment, or the feeling of a prosthetic being one with the rest of a patient's body instead of a foreign object. This knee comes in 3 layers. The first connects the severed tissue directly to the prosthetic and can't be removed without additional surgery. This direct muscle attachment restores the push-pull function of muscle and helps the patient with spatial awareness of the prosthetic. The second layer is drilled into the severed femur bone, which eases fatigue and grants better mobility than the traditional method of a socket cup, which is known for causing both nerve pain and chafing. The last layer is robotic, and it attaches to the implant itself. Tony Hsu, the lead author of the study done by MIT's Yang Center for Bionics, said that factors like embodiment contribute significantly to patient well-being and autonomy. If you want to see a video of the bionic leg, check out the link in the show notes. Thank you to our sources for this episode: Becker's Hospital Review, Modern Healthcare, NPR News, AP News, KFF, Medline Plus, and Good News Network.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.